Hi everyone, welcome. I am Dr. Dilsora Fozilova. In today's class, we are going to talk about sociology of health and wellness. So what is sociology of health and wellness? Sociology of health and wellness is the subsection of sociology or the sociological study of health, illness, and healthcare or shaped by social factors, not just biology or individual behavior. It looks at how society influences who becomes ill, how people experience illness, and what kind of healthcare they receive. So sociologists basically ask the question of not the question of what disease caused this, but the question of who gets sick, why this specific people get sick, how do inequality, culture, institutions shape health outcomes for different groups? How does the healthcare system help or fail different people? Some of the key ideas in sociology of health and wellness can be social determinants of health. Social determinants of health are like income and poverty, for example, how different income levels affect people's health outcomes, or education, how education shapes people's understanding of health and wellness, and how at the end that affects health and wellness. Race and ethnicity, gender, housing, work conditions, access to nutritious food. This is just kind of like a question of in our time that organic food are very expensive, and people who cannot afford very nutritious food end up buying like half processed food from the big superstores or Walmart or wherever. And then the health outcome of that can be various things, right? And there can be obesity or not enough vitamins or not enough nutritious substance in that food. So outcomes of that is different. And also social support. These factors often matter more than medical care itself. Another key aspect of sociology of health is health inequality. Different social groups experience dramatically different levels of illness and life expectancy. So you can even see between men and women live a couple years more than men. And it can be for various reasons. The reasons behind that is men might work in more dangerous jobs. Men might smoke or drink more or take more risks, so that we can see the differences and we can analyze them. Why marginalized groups have poor health, or how racism, sexism, and class inequality affect care. So those are health inequality aspects of healthcare. Or why some communities have access to better healthcare than others. One of the documentaries assigned to you is Sicko, and that talks about healthcare system in USA, and that compares that healthcare system with Canada and other parts of the world. So another key aspect of sociology of health would be the medical system as a social institution. So as we study social institutions, they are organized patterns of people, and all these different organized patterns of people make different social institutions. For example, law is a social institution, government is a social institution, media is a social institution, education and healthcare is another social institution. Healthcare is not only biological, but it's socially organized. That sociologists examine who gets access to care, how healthcare is funded. Is that funded by the governments or funded by people's own money or insurance companies? The power of doctors in pharmaceutical companies. For example, Michel Foucault talks about psychiatry and says that when people are diagnosed with mental illness, they lose their power of decision making. That doctors sometimes don't ask them if they want this certain medication or other things, right? They viewed as mentally ill and unable to make logical decisions or reasoning, right? So how insurance companies, for example, shape treatment. And if I want to get certain sorts of treatment, and if I don't have the money and the insurance company is not willing to pay that way of treatment, so what happens? Who makes that decision? What happens to my health, for example? How politics affects health policies? Those are the big questions, and the sociologists working on the take care of it. Take care of it. Works on the understand it, learn it, and conduct research on these topics. Illness as a social experience. So illness as a social experience, Talcott Parsons writes a book about it. I think it called like I forgot the name of it. Anyways, I'll tell you when I remember it. So he writes a book and he analyzes being sick. So there are certain way of being sick that if you just say like I'm not coming to class, I'm sick, and if you sound okay, I will question if you are sick. If you just cough and say, I'm not feeling good, Dr. Fozilova, I cannot make to the class. I'm like, yeah, that Alex seems very sick, right? So if there's Alex, I'm not picking on you. I'm just first word came to my mind. So yes, that Talcott Parsons talks about what experience of sickness, and then there is expectations of how to behave. That when somebody is sick, what we expect is seeing them being in bed, miserable, and taking some Tylenol and coughing and being having no energy. Like those are the symptoms we expect from the ill person. It's funny, but it is. And also we expect them to seek for treatment, and we expect them to get better, right? So there is a sick leave at work, like you can take certain days off when you're sick. So that's expected, like people get sick. And also there's an expectation after that time, you need to come back to work. So those are very important aspects of illness as a social experience. So also the sociologists ask questions of how do people make sense of being sick? How does illness change identity, daily life, or relationships? For example, some long-term life-threatening illnesses like cancers. Certainly, our scholars look into how that changes identity. Even the simplest thing is after radiation, some people lose their hair, how that affects their sense of identity, or how that affects their relationships, right? So how is mental illness understood differently across different cultures? That is another question we often ask. Also, another very important part of sociology of health and wellness is medicalization of illnesses, or medicalization of normal life problems in later days. For example, the thing is like ADHD or menopause or addiction, obesity, childbirth, aging, or natural stuff that happened all the time, even long, long times ago in the human history. But now, only now, we are medicalizing them. The one of the best examples can be aging. So if you do a little bit of research about aging and how that's medicalized, you can see a lot of information. You can get a lot of information that people, especially when it comes to women, there is a pressure of looking young, or being older is somehow stigmatized. So therefore, they seek all different kinds of or ways of staying younger. They might consider that surgeries, for example, injections, or they can take certain stuff. I'm not sure, but I think there's a people take collagen. Um, I don't know what other things you can take, but people certainly try their best to stay as young as possible, which wasn't the thing before. Now, oh well, it's maybe not right. Like I have read stories about Queen Cleopatra using all different kinds of natural treatments to stay beautiful. Perhaps it always existed, but in our time, it is more medicalized than ever before. So another aspect of sociology of health and wellness can be how wellness is prevented or wellness prevention and all cultural aspects of it. How culture shapes ideas of healthy living. What is healthy living for different cultures? The fitness and diet industries, how they are telling us what is healthy being and how can we stay healthy in this society. Mental wellness and stress, social pressures around body image, for example. I often talk about that such a tension created in society. Actually, 70% women, actually the research shows that, thinks they are overweight, even the skinny ones. So 70% of women means like substantial measure, right? Substantial part of women in society. So if this much woman is thinking that they need to lose couple pounds, so there is a stress and tension about body image, and it's not about the how skinny or not skinny they are. It is the social pressures about around body image. So those are the stuff sociologists want to know, because those are the ideas or those are the pressures affecting society today. That's the very topic of or interest of sociology. And another question would be how wellness becomes lifestyle or identity. And in one sentence, sociology of health and wellness examines how social structures, inequalities, cultural beliefs, and institutional systems shape our health, illness, and access to healthcare systems. So this is very short video of what is sociology of health and wellness. I'll see you in the next video.